thanks everyone for staying with us. I'm Ben Pelled, the organizer of the conference, and welcome to our fireside chat with Oron Afek, who's the co-founder and CEO of Vim. And Vim is basically a healthcare technology platform that aligns incentives between payers and healthcare providers to enable value-based care decisions. The company's platform uses collective intelligence from healthcare data and human expertise to guide patients and providers to care decisions that consider cost, quality, and individual preferences. Now, before we start, let's remember that the US healthcare industry is highly fragmented and healthcare costs make more than 18% of US GDP. So we're facing a multi-billion-dollar problem here, and Vim is trying to fix a part of it. So Ron, good morning to you on the West Coast. Actually, you're on the East Coast, right? Where are you joining us from?
Hey, Ben, morning. I actually want to make one small correction. It's a multi-trillion-dollar problem that we're tackling if you consider almost 20% of the GDP. I'm calling today from Montauk, New York. Came here for a small company retreat.
Crazy. Okay.
Good to see you.
Good to see you. Good to see you. And again, thanks for joining us. So over the next 20 minutes, we're going to chat, and we have some questions to ask you. And maybe you can start with giving us a little bit of background. We're actually friends, Oron and I, so we grew up together in Tel Aviv. We're the same age. So I personally know Oron, but Oron, maybe you can tell us a bit about yourself to the audience who's joining us from Israel and from around the world.
For sure. Thanks, man. And thanks for having me. As you know, BookMD it was the original company we started almost 6 years ago, then evolved into Vim close to 4 years ago. I previously started a couple other companies out of Israel before moving here to the United States to start Vim. They're mainly in the telecommunication and the gaming sphere. So a pretty big shift for me to go into healthcare. My original desire and my co-founder's original desire was to actually look for deploying marketplace dynamics in a big industry like healthcare. And that was the original desire of why we came up with this idea for Vim. You know, marketplace has been built in many very established categories like e-commerce with companies such as Amazon, you know, in transportation as a service with companies like Uber and Lyft, and places like hospitality like, you know, Airbnb. The thing is that in healthcare, there are the same characteristics in the United States that you would expect to see in a market that is ripe for a marketplace from an economic standpoint. So you would think about very, very, very deep cost and quality variation, right? So basically, there's no correlation between a cost of a service and the quality of a service. The prices in the United States of healthcare services are kind of really ballooned into scale that is unheard of. So you could, but there's also a huge variation. So you could see, let's say someone want to go through a hip replacement, you know, she could find a service for, you know, $12,000, you know, $20,000 in one place, and then she could pay $120,000 in another place. That could be like the same zip code.
Wow.
Right? So when you see that there is a big cost variation, and without necessarily like you know, quality adequacy or quality matching of that variation, then you know, wow, that's an opportunity for a marketplace for using technology to create a value-driven system where people follow value and not brands, for example, right? So this was the original inspiration. We've been trying to keep on that specific direction in the past, you know, 6 years. We're coming into our 6th anniversary this June. And I'll be in Israel to celebrate it with the team. That's been the motivation behind the company up until now.
Yeah, congratulations. Thank you for telling us about your vision, your motivation, which is you know, the first thing you wake up in the morning for, right? And you mentioned 6 years, and I read that you went through a few pivots, right? A few years of trial and error until you found the right product market fit. Maybe you can tell us a bit about that. That's, you know, that's something that every entrepreneur can learn from in their own company, right?
Absolutely. You know, I think thinking as a marketplace, you always think about, okay, where do I start? Who do I influence first, the chicken or the egg? Who do I influence first? And eventually it boils down to who makes decisions in healthcare. Mm-hmm. And I think the original assumption that the consumer in the United States, the patient, is going to make the decisions was wrong, right? We've been living, especially after Obamacare, there was a big cost shift to the employee, to the patient, to the member, how the insurance company calls them. And we call this high deductible health plans. So, instead of the insurance company start paying the dollar from the first service, Obamacare helped accelerate the transition to high deductible health plans, which was a trend even before Obamacare, back in the day. But, you really saw that patients are now, they need to pay out of pocket, and they're in for $3,000, $4,000, $5,000 before their insurance kicks in. Similar to how you would experience a car accident in Israel. You would need to make the decision of whether I need to, call my insurance or not, or maybe I just pay out of pocket if it's below a certain threshold. Similarly, in the United States, those high deductible plans shifted the thinking of companies like BookMD in the day, now Vim, to start thinking about, okay, now the consumer is empowered, they have skin in the game, how can we influence them? And by the way, you do see amazing companies like Hippo Insurance and Limited Insurance going consumer first and being very successful. It took us 2 or 3 years to understand that's not the approach. The patient, even though they're deep into their, the consideration of their, through their deductible and expenditure, they're not really making the big decisions in healthcare. They blindly, on average, listen to their physician when she's the one making the real decisions, right? I mean, one can make a decision of whether I'm going to go to, have my flu shot here or there, choose that primary care physician or whatever. But when things go south, like they say here, and someone needs to seek an oncologist or an expensive service or a cardiac surgery, it's usually the physician that guides you where to go. Right. So to go from the patient-facing marketplace to a doctor-facing marketplace and be able to influence the physician, that's been a big shift. Now, the second big shift was, we originally worked with employers, big, large employers like Disney. Now we work with the largest insurance companies in the United States, like Anthem, United Healthcare, and others that cover almost half of the Americans. Now, the idea to move to insurance companies was that in order to influence physician decision, you need to aggregate enough lives, enough members, enough patients to really make a difference for them. So that was I would say, the second pivot, shifting from employer-facing to insurance company-facing in order to immense enough power to influence the doctor decision, who is the ultimate decision maker. Mm-hmm. And the last part was to influence the doctor's decision, you really need to be inside the existing workflow, or otherwise, if you've been a standalone system that they need to, it's not going to work, right?
Yeah, you have to
nobody's going to use it.
Right. So, and you probably have to connect to so many legacy systems. So maybe you can tell us a bit about your technology. How do you do that?
Yeah, and that was the latest and greatest, and that's what allowed Vim to really break through and get to product market fit in a meaningful way. Our system today is enabling us to basically do the holy grail of interoperability, which has been a long far cry here in the United States, and billions invested in trying to solve for this problem that haven't been solved. Obama himself invested $70 billion into interoperability and get EHRs, electronic medical record, to get adopted with medical practices, but it didn't work well. So what we have is a bunch of hundreds and hundreds of different electronic medical record systems, legacy technology. And what we do uniquely is we found a way to not only integrate quickly into the system, I'm talking about minutes, mm-hmm. instead of 12 to 18 months, which would otherwise take on a per practice level. So minutes. Mm-hmm. It also gives us freedom to operate within the user interface like never seen before. Mm-hmm. And the ability to deploy applications that have freedom to ingest and deploy different type of data into that legacy user interface. And we're deploying those things as a platform. So it's not that Vim is the only user who can build apps on top of those platforms. Our clear intention is to open it up for third-party developers, many other innovators, to deploy their own apps on that. So that's pretty exciting.
Yeah, pretty exciting for the audience in Israel, maybe, right? I mean, the startup nation here. So, and your R&D team and CTO are in Israel, co-founder and CTO, is that right?
Yeah, Ben. Most of our team is actually based in Israel, in Tel Aviv. It's 70% of the company. So we have obviously my co-founder Asaf leads the R&D team, the product team. We have QA, we have professional services team. We actually have a delivery team in Tel Aviv. So it kind of almost everything outside of go-to-market functions is based in Israel.
And now with COVID, and that's a good segue to the next question. So with COVID, are you, first, how has COVID impacted your business? And second, are you hiring now? And are you open to hiring people from all over the world or just in specific locations? I mean, do anyone in your company work remotely? Does anyone work remotely?
Yeah, for sure. Two great questions. Let me take the COVID one first. COVID has been of a huge impact on our business, in a positive one, fortunately. So here's what's happening right now. The American healthcare system is built on a fee-for-service basis, which means that, similar to a lawyer, you would bill for time and materials when people using your services. Differently in places like Israel, the UK, you're in a fee for health system. So the doctor gets a paycheck to make sure that everyone is healthy, right? So while doctors in Israel, not talking about the ones who populated the corona departments in hospital, which worked, day and night, the primary care physicians in Israel actually benefited during COVID because they've been getting their paycheck. People stayed home. They've been very healthy, less injuries, less disease, less flu. Perfect, like great days. In the United States, primary care physicians almost bankrupt because people stopped showing up at the clinic. Guess what? Doctors are not making money because they can only bill when they see a patient. So, and obviously there was a shift to telemedicine and people have been able to recoup some of the revenue, but not all of it. And, overall people have been healthy. It's kind of funny to think that the healthier you're here in the United States, the less money the doctor makes instead of making it the opposite. It's like the most perverse incentive.
Totally different than what it is here.
Yeah, and it's a perverse incentive. So now there is a huge shift to value-based care. Value-based care means the healthier the patient is, the more money I make out of shared savings below a certain threshold, a certain benchmark. So that whole concept of shifting to value-based care requires a lot of coordination of care that is not possible in those siloed IT systems. And when Vim comes in and breaks those silos with technology, suddenly we become a really, really important player in value-based care. So now there is a big momentum that clinics want to shift to value-based care. Payer, those insurance companies, they want to shift to value-based care, and someone need to enable that. So that connectivity between payer and provider that have been very siloed up until now is what Vim does, and that's why we're seeing a big momentum for our business that nobody would be able to would have been able to expect or to foresee.
Yeah, great. So one major trend that you've identified in the past, and you're capitalizing on it now with Vim, right?
Yeah. As per your second question, Ben, on the model that how we operate. So in Israel, we definitely have a very tight office culture. Most of our people are, they know each other from back in the military, mainly the Air Force, but also some of the, 8200, intelligence forces. But people like to stay tight. They like to stay in the office. They, stick together. We do allow for a hybrid model in Israel. So work from home or come to the office, and there should be at least a few days a week you come to the office and hang out. In the United States, we went to a fully remote model where we can hire anywhere in the United States, and we're really, really investing in our remote model and how we basically create, a well-functioning organization over time, going away from tight coordination and into like very good asynchronous communication and autonomous teams that can operate autonomously. If you want the Amazon two pizza team concept, where you're really building teams that can operate separately in an autonomous fashion, different agnostic to time zone and location. I think COVID helped our customers to realize that instead of flying us all over the country to meet them in person, it's okay to hop on a Zoom call and
Sure.
actually have people opening their video and communicating. And every once in a while you do need to fly and build relationship in person, but overall it's been very, very productive. We don't currently hire people outside of the United States to fill go-to-market functions. We want those people to be Americans that understand the American healthcare system and live here. But for the other functions like R&D, we definitely have folks in the Ukraine, and we are considering other markets to expand our team. But that's been obviously this hybrid model has been challenging at the beginning, but over time I see that there's a huge benefit for us.
Mm-hmm. Okay, cool. So that leads me to the next question. You recently raised, was it $24 million for a total of $60 million or so, right? That's what I read in the media, but what are you planning to do with the money?
Yeah, so we raised over 80, and then you're right that the 60 is our B round, and we just completed our B round. And the reason, when you work with a doctor in the United States, that doctor is not employed by a single insurance company. Like in Israel, you either work for Maccabi or Clalit, or maybe two of them, but that's it. In the United States, you can have 20 insurance companies you work for. Now, if only one insurance company is trying to offer you as a doctor something, to collaborate on with technology, you're not likely to agree, because it really fragments your workflow in a way that is just really it's just more of a hurdle than a benefit. Mm-hmm. So in order to do that, you need to create an ecosystem where insurance companies all agree to work with a single vendor, a single partner like them, mm-hmm. to then integrate with those physicians who basically meet patients on a multi-payer, multi-insurance company basis. Mm-hmm. And that's, so part of the way we've been solving this is we've been breaking down our B round to mm-hmm. allow multiple strategic investors to participate. And by participating, we help to further align their incentive to collaborate in a multi-payer fashion. So we're the only healthcare company in the United States, I think, not just the Israeli, the only healthcare company in the United States that's been able to attract capital from so many different strategics, like United Healthcare, Anthem, Premier Blue Cross, Florida Blue. Yep.
So there's some of your clients or potential clients or ways to get to your clients, to the insurers, right?
Absolutely. Our biggest customers are insurance companies, and you can only invest if you're a customer and if you're a big customer. Mm-hmm. That's the only way you could invest in the company. And so we have different models that allow for local collaboration. We also have some revenue share structures locally, and other cool models we do financially to incentivize multi-payer collaboration. One of them is to allow some of those partners and customers to become equity owners in our company. And as you could guess, it also allows us to call capital whenever we need that. So we're not constrained by the state of the market. And maybe there's if there's an economic crisis or an inflation or some other factors that influence the ability of tech companies to raise money, we are less constrained by those cycles, given that those insurance companies are going to get paid. Even in bad times and good times, people need to have insurance, so they make money.
Yeah, and they have deep pockets. So it sounds like you have everyone aligned, your clients, your investors, who are sometimes usually the same, and your company, and maybe the physicians and the patients as well, right? Who doesn't want to get better quality healthcare at a lower cost in a more efficient way? So great. So way to go. We have a few more minutes left, Oron, so maybe you can share with us a few tips, to the other entrepreneurs here in the audience. They're all in digital healthcare, but of course, there are different segments. Most of them are probably not in health insurance. So maybe some general tips to anyone entering the healthcare industry that is usually heavily regulated, and you know, that uses old legacy systems. How do you solve the
Yeah.
problems there?
Yeah. So obviously, my tips are going to be very, very focused and oriented into digital care business in the United States. That's the only thing that I understand. I guess that anywhere else, I'm probably not the best person to ask. But if you ask me about digital healthcare in the United States, especially for Israeli companies, knowing Israeli entrepreneurs and how we think, um, a few things. First, I think that uh, at least the market facing, the hustler part of the founding team, or if it's a sole founder, the founder of the company, they need to be in the United States. Even if you build something that has really deep tech involved, uh, the sales cycle in US healthcare is very much influenced by relationships. So it's not always the best tech wins, like maybe we see in other industries where there's much more sophistication and data-driven decisions. In US healthcare, data-driven decisions are second to relationship and trust. Those organizations, those insurance companies, medical provider groups, sales cycles are really, really long. And you accelerate sales cycles with building relationship that in turn build trust. And then you also building momentum in a local market that gives you trust. People see that you work with other large players, that helps you to accelerate your work with other players. So to do that, you really need to commit to move to the United States. That's the number one advice I would give to any earlier stage company who try to make it in digital health in the United States. The second thing is, don't assume that you would build it and they'll come. Especially not when you're building something for patients, for consumers. Patients are not the real decision makers in healthcare. They may be paying the dollars. They may be the ones that eventually sitting in a surgery room, but and getting the service done. But they're not the real decision makers. And building things to engage patients directly, even though we've seen good examples like GoodRx, we've seen other companies that been able to make really nice dent in direct to consumer. I think Amazon is going to make with Amazon Care some impressive direct to consumer plays. I would say that there is definitely an opportunity there, but the bigger low-hanging fruits, most of the opportunity is in the enterprise space, and in the enterprise space is selling to physician groups and insurance companies, and that's where you need to be cognizant that the decision maker is not the patient; it's the actual enterprise, and that also that kind of cut both ways. I would say. The third thing, find U.S. capital. I mean, if you want to start with a local Israeli fund, that's great. Eventually, strategic capital here in the United States is really helpful to really break through a lot of the noise. Literally, like raising money from your future customers. Most of them do that. The big insurance companies, the big medical providers, they have their own investment funds. So definitely consider that as a way to propel your early days. It's been really, really helpful for us. And make sure that when you do raise money, they also commit to bring business. It's part of their commitment, and you make it and you make a carrot and stick for it. Other tips: build a really strong remote culture. I think smart people want to work from home. They want to stay close to their families. They want to
or travel like you do,
or travel like we do, right? So I think you don't force them to go to the office and hurt that quality of life. Instead, invest in really, really good communication system, in really good operating models, things that allow your company to scale remotely, and then bring people together every once in a while. It's really powerful, but don't force them to an office space, because the economy has changed, especially here in the United States. I mean, the fact that office space in Tel Aviv is at all times high is mind-boggling to me. But I can also understand, because in Tel Aviv, everything is in Tel Aviv. When you're in America, office space is in all-time low right now, because nobody wants to go to the office, and you can buy real estate in New York City in like very, very cheap money. So people just want to stay in the suburbs. Yeah, that's the main tips, I think.
Yeah, great tips, Ron. Thank you very much. And thanks very much for everything that you shared with us. It's been an absolute pleasure to have you with us in this virtual event. And I can't wait to see you in our next event. And hopefully it'll be an in-person event in Tel Aviv.
For sure, Benno. Thanks for having me. Looking forward to see you in June. And yeah, hopefully in person soon in one of your guys' events. And once again, thanks for supporting digital health, and amazing momentum for Israeli companies. I mean, we see Israeli companies here all over the market, with amazing, people and ideas and innovation and backers. So just keep on coming. It's pretty awesome.
All right, will do. Thank you.
All right.
Thank you, Ron.
Thanks.
All right, peace.
Talk to you soon.
Oi, it's empty.